All right, now that we've covered all the sutures of the neurocranium, let's take a look at the viscerocranium now. Starting off looking at an anterior and a lateral perspective. So starting off first, you can see on the bridge of our nose, we have two bones which are coming together. These are known as your nasal bones, and these form that bridge of your nose. And these are actually relatively weak connections. So if you're hit hard enough on the bridge of your nose, you can actually fracture those nasal bones quite easily. So these are the nasal bones, and on either side of the nasal bone, we have this portion of a larger bone, which is found right here. These are known as the maxilla or the maxillary bones. And there are two maxillary bones which come together on either side. So we have two nasal bones, two maxillary bones, and then on either side of those maxillary bones, kind of like within the orbital cavity, we have these little lacrimal bones right here. And then as we work our way laterally, we have that cheekbone that I was mentioning before, which articulates with the temporal bone, the zygomatic process of the temporal bone. Remember, I told you this is the zygomatic bone. So this is what makes up your cheekbone. So we have two zygomatic bones on either side. And then coming inferiorly, this is where we're going to have our mandible. Now we only have one mandible, and the mandible makes up the entire jaw. So this is the movable portion of the viscerocranium. So this is the mandible, and then found within the nasal cavity, we have this little bone right here. This is known as the vomer, and we'll take a closer look at this in just a second. And then we also have two bones found within the nasal cavity right here and right here, and these are known as the inferior nasal concha. These are separate bones. Remember, the middle and superior nasal concha are part of the ethmoid bone, where the inferior nasal concha is a separate bone and is part of the viscerocranium. Looking at that vomer again, here it can be found right here. This also makes up part of the nasal septum. So we had that perpendicular plate of the ethmoid right here, and then here is the vomer making up the posterior inferior aspect of that nasal septum. Looking at that from an inferior perspective, we have that vomer right here. Again, we have our nasal bone right here. We have our maxilla, which is this bone right here. And then we also have our mandible right here. Now, one bone that's found on the interior aspect of the viscerocranium is known as the palatine bone. And this is going to sit at the posterior aspect of our maxilla. So here is the hard palate of the maxilla. And then posterior to that, this is where we're going to have our palatine bones. So we have one and two palatine bones. So again, just to recap, we have two nasal, two maxillary, two lacrimal, two zygomatic, two inferior nasal conchae, as well as two palatine. So that's 6 times 2, which is 12. And then we have one vomer and one mandible, which is 14 bones, which comprise the viscerocranium. So now let's take a look at the mandible in a little bit more detail on some of its features. Starting off here, we have what is known as the mandibular condyle. And this is actually the portion which articulates the mandibular fossa of the temporal bone. And this forms that temporal mandibular joint. So we have the mandibular condyle, and on the medial aspect, we have the condylar process, which forms the articulation. We then have this mandibular notch, which connects the mandibular condyle to the coronoid process on the anterior aspect, seen right here. So mandibular condyle, coronoid process, mandibular notch. And then as we continue down, we have what is known as the ramus of the mandible, as well as the body of the mandible. And at this angle where the ramus and the body meet, we have the mandibular angle right here. And then all along the superior aspect of the body of the mandible, we have these alveolar processes right here, right here, right here. These are where the sockets are going to be for the teeth to sit into the mandibular bone. So these are the alveolar processes. On the anterior aspect, we have the mental protuberance, which is kind of where your chin is. You can kind of palpate that. And then on the inner aspect, we have some structures. We have one, this is a lingula. This is kind of like a little bony outpouching. And this lingula is going to be a good landmark for where you're going to have your mandibular foramen, which is found just posterior to that lingula. And that mandibular foramen, this is where we're going to have the inferior alveolar nerve and artery, which are going to come in and travel down through the mandibular body and supply these teeth as well as some of the chin region. So that inferior alveolar nerve, it comes in through the mandibular foramen, but then it exits through this mental foramen right here, and that's where it supplies sensory to the chin area. And then finally, we have a little line on the medial aspect. This is known as the mylohyoid line. This is where the mylohyoid branch of the inferior alveolar nerve comes off and provides innervation to the mylohyoid muscle on the floor of the mouth. I know that was a lot of detail, but all those little details play a big part when you start to learn the details about facial anatomy. Now, taking a closer look at the maxillary body, you can see we have some articular surfaces right here and right here. This articulates with the frontal bone as it comes upwards. Then this articulates with the zygomatic bone as it comes laterally. Here is going to be the floor of the orbital cavity, which is formed by the maxillary bone. And then, like on the mandibular bone, how we had those alveolar processes, we also have alveolar processes on the maxillary bone, and they can be seen right here where the teeth are going to be found. And then located directly in the center of the maxilla, we have this opening. This is the inferior orbital foramen. This is where we're going to have little nerves that are going to come out to provide sensory innervation to the surrounding structures. All right, so that was a lot. We covered a lot of bony structures. Now let's take a look at some practice questions. So the first question is asking you to identify this bone. What bone is this? The second question is asking you to identify structure A. Let's say specifically this structure. And then question 3 is asking, what does structure B articulate with? So that is this structure right here. So of course, pause and answer these and then come back once you've answered them. I'm going to go through and provide you with the answer right now. So what is this bone? Well, what does this look like? To me, it almost looks like a bat. I am a terrible drawer, so that is my best bat. But you can see we have these large wings right here and right here. We also have this body right here and these little feet. So this looks like a bat. So what bone looks like a bat? Well, that is the sphenoid bone. So this is going to be the sphenoid bone. So now that we know that this is the sphenoid bone, what processes or what bony feature is coming down and sticking, acting like the feet of the bat? So what is this structure right here? Well, these are the pterygoid plates. Remember how we have a medial and a lateral pterygoid plate? This would be the medial pterygoid plate, and right here would be the lateral pterygoid plate. And then finally, what articulates with this surface right here, or this structure? Well, this is the lesser wing of the sphenoid bone, and this sits kind of like on the top shelf of the sphenoid bone, and this is going to articulate with the frontal bone, the posterior aspect of the frontal bone. So B articulates with the frontal bone. Awesome. Now on to the next set of questions. So identify the area indicated by the circle. That's this region right here. Identify structure A, which is this bone right here. And then what does structure B articulate with? So what bone is this and what does it articulate with? So let's go back to the first question. What area is this? Well, you can see we have 4 bones coming together. We have our frontal bone right here, our parietal, our temporal, and our sphenoid. And these form that suture known as the pterion. Remember, this is that weak area in the neurocranium. So question 1 is pterion. Question 2, identify structure A. Well, this right here is going to be the nose. And if you remember what 2 bones make up the bridge of the nose, these are pretty easy. These are going to be those nasal bones. All right, finally, what does structure B articulate with? So this is structure B. Remember, this is that zygomatic bone. This makes up that cheekbone. And we didn't necessarily cover it, but I think you might be able to put the information that we covered together and solve this question. So this articulates actually with 3 bones. We have the temporal bone back here. Remember, we have that zygomatic process. We also have the maxillary bone anteriorly with that zygomatic surface of the maxillary bone. And then up here, we have the frontal bone articulating with that zygomatic bone. So we have frontal, temporal, and maxillary bone. Awesome. I hope you were able to get those questions correct. Here are some of the references if you want to take a look at the images we used. But anyway, that's it for today's lesson. I hope you all enjoyed that one, and I'll see you in the next one.